get started?
Yeah, so welcome everyone to the WAV, the Western Association of Biofeedback and Neuroscience. And we're going to have a wonderful presentation today from Yair Lurie, Cardiowell, is that true? Mm-hmm. Cardiowell, and Dr. Stephen Sideroff and Dr. Beth Argus from University of California at the Los Angeles campuses. And without any further ado, I wanted to pace the presentation in the following way. At some point, there will be time for questions, one or two after. We'll have a longer period afterwards, and then a little bit of a moderated discussion. Is that a fair representation? Good. All right, you're on.
Okay. So I'm going to start off the talk. My name is Yair Lurie. I'm going to be talking about strategies when I'm doing research on continuous heart rate variability monitoring. And Beth will be speaking after me about her experience with patients at UCLA, and Dr. Sideroff will be finishing off the talk with his experiences and use of the solution in anxiety. These are solutions that have been used in clinical practice. The disclosure is, to use your best judgment when applying these in your clinical practice. So I'm going to be focusing on four parts in my talk. I'm going to be rather quick. It's going to be very high level. I'm going to keep it down to about 20 minutes, and then Beth will start after me. I'm going to be focusing on devices, the type of devices to consider, considerations for the devices, how to control for confounding factors, variables, some talk about designing experiments, and some applications. And we heard yesterday there's hundreds of wearable devices now on the market. There's not as many heart rate variability wearable devices, and heart rate variability can be measured in different ways depending on the device. But the gold standard is a device that measures heart rate variability using ECG. The second best one is a device that uses photoplasmography. That is the light that shines into the skin to detect each heartbeat. That's used by HeartMath, for example, and the Apple Watch. And there's other newer technologies that can monitor heart rate changes from a distance, actually like through your mattress. And that's called ballisticography. And there's new technologies that actually use video signals that can detect the changes in your color of your face that you can't even see yourself, and they can detect pulse that way. And there's a new technology that actually uses radio waves that bounce back off the body, and that they can detect your heart rate from there. But the gold standard is the ECG, and when we're measuring heart rate variability, we're talking about devices like this, ones that you wear on your wrist or on your chest. Lately, we've been experimenting with a patch, an ECG patch that you can wear for up to 3 days at a time that provides biofeedback on your heart rate variability. Another option is using a chest strap. These are the preferred devices because they measure right from the source, right from your heart through an ECG. And so when you're doing continuous ambulatory heart rate variability, you want to consider the device, the measuring instrument that you're using. And there are so many different devices out there. You want to make sure that you pick the best. And so these are some considerations to decide that you want them to be using the latest standards. You want them to give an output, a measurement that's scientifically accepted. You have a choice between an EEG type, ECG type reading, or a PPG reading. And then different devices have different characteristics. Some devices that you buy give you access to the raw data, others do not. And so you want to make sure that whatever device you use, that you have access to the information so that you can analyze it as part of your research. And of course, accuracy. You want to make sure that the device that you're using is accurate. And then you also want to consider, the type of device. There's many places where you can get an HRV signal from, with the chest being the most accurate. But we saw solutions with a ring, for example. Measuring from the ear is also an option. People have been measuring heart rate from a sensor on the waist and the wrist. I won't talk too much about the Apple Watch, but the Apple Watch is increasingly becoming more of a viable solution for heart rate variability monitoring and biofeedback. There's a number of considerations about the Apple Watch. We won't go into detail, that would be a talk on its own. But it's really unique that they have recently released a feature. It's kind of like a biofeedback feature. And what it does is it looks for changes in your heart rate over 10 minutes when you're not moving. So basically it takes your baseline, and if you're sitting still and it detects that your heart rate has increased up to a certain level or decreased to a certain level, you'll actually get a notification letting you know that your heart rate has changed for some reason while you're sitting, where, you know, which we wouldn't expect your heart rate to change significantly while you're sitting. So there might be an underlying condition, most likely some kind of arrhythmia. So that's really interesting, but not so useful for biofeedback. And you know, when we're doing heart rate variability, we're measuring the autonomic nervous system, the parasympathetic nervous system, which is very sensitive to so many factors. And so it's important to understand all the different variables that can affect your readings. And there are a lot. The time of the day that you take the measurement makes a difference because of your circadian rhythms. The environment that you're in and the temperature of the environment makes a difference. Whether you've eaten before the measurement or not, and the kinds of foods can affect the results. Noise, when I refer to noise, I'm referring to like artifacts, to like movement and changes in your heart rhythm that can affect the results. And of course your behavior, what you're doing at the time of the measurement will play a factor in the results. And as well as your age and your emotions. So as an example, here's a longitudinal analysis of the changes of heart rate variability throughout the day. And you'll notice that the heart rate variability dips around noontime and then rises as you're going to bed. And then when you're sleeping, it's at the highest, and when you wake up, it lowers. So if you're taking measurements, you want to make sure that you're taking the measurements at consistent times to compare the results. And similar how your heart rate variability changes throughout the day, you know, other factors such as your blood pressure actually also change throughout the day based on the circadian rhythm. And so if you're looking at an intervention for blood pressure and you want to see the results of a particular treatment, you want to make sure obviously that you're measuring the blood pressure in a controlled environment at a controlled time so you can compare, you know, over time. And I mentioned how diet can affect your results. Here's an example of alcohol. If you're drinking even one drink, the more you drink, the more your heart rate variability will be lower. And as you get older, your heart rate variability naturally decreases. And so when you're comparing results, you want to compare results within a certain age group, so you have a more valid comparison. So there's a lot of confounding factors which makes researching heart rate variability very challenging, but if you know the factors and then you can control for it, you can have stronger results. And so when you're developing a research design, you want to obviously keep these things into consideration because there are, like I mentioned, a lot of challenges. And throughout history, there's been very poor standardization in research. People who have published research have been using different types of devices on different types of patients, and so the results out there aren't very well standardized. It's very hard to compare one study with another study. And context makes a big difference because the time of the day, the location, what the behavior affects the results. And so when you're doing the research, you always have to understand the context that the measurement has been taken. because the autonomic nervous system is so sensitive. So I'm just going to go ahead and skip. So there's basically two designs, two basic designs you can do. You can do between subjects or within subjects. And traditionally, the medical literature has been focused on between subjects in population studies, where they take a group of patients, maybe heart disease patients, and compare them to a group of normal patients, or a group of diabetic patients versus a group of hypertensive patients, because they want to look at gross differences between these populations. And so when you have a big enough population and a big enough sample, you can control for a lot of these confounding factors, right? And so it makes it a little bit easier to compare between groups if you have a large sample size, because the variance between each individual within the population is averaged out. And so most of the literature that you'll read is based on between subjects. But that doesn't really help us as biofeedback therapists, because we're dealing with patients individually, right? And so what you want to do is you want to study within subjects. You want to study the effects of therapies, of interventions within a subject, because it's, like I said, very hard to compare between two subjects, because there's so much variability, for example, between myself and Steve, that you can't really control for that. And anyways, in biofeedback, we're not comparing one patient with another. We're focused on that individual to improve their health, to give them personalized interventions to make their life better. And so we want to see the effects of our interventions within the individual. And so that's what's recommended when you're doing heart rate variability, is just to compare the results within the individual from day to day. And that's a longitudinal type of study, because you're following a patient throughout therapy and you're seeing their improvements over time. And what you want to do is you want to measure, obviously, the responses of your therapies, of your breathing exercises, of your cognitive behavioral reframing, of any type of lifestyle improvements that you're making, to see if those changes, those interventions are actually making an effect. And you measure that effect, obviously, through heart rate variability as one way. Another use is measuring wellness. Some people say, and I kind of reframed it, some of the literature out there is we want to measure someone's stress, but another angle is, no, you want to measure their wellness. And maybe if they're not very well, then that means they're stressed. And so how do you measure how well somebody is? We know that RMSSD, heart rate variability, is a strong predictor for death and overall health. And so in my belief, heart rate variability as a single measure is the best indicator of how healthy somebody is. And so how do you measure that individual's wellness? And then the other benefit, obviously, is biofeedback. Solutions that in the day, in the moment, can give you feedback on what's going on in your body. And that's what we want to do, to shape a user's individual and make them aware of the factors in the moment that are affecting their health. And so I want to focus on those two applications for heart rate variability. Continuous heart rate variability is a spot check to measure how well the individual is today, and as a solution for making them aware of the stress that's happening in the moment, so that they could essentially bounce back from it by breathing, for example. So spot checking your wellness. So the best practice for measuring an individual's readiness is how well their body is prepared for the day, how healthy they are, is by doing a baseline measurement in the morning. The first thing in the morning is probably the best time to take a baseline heart rate variability measure, because we're controlling for the most number of variables. We have a known environment, we have a known time of day, we have very little environmental influences. The person hasn't eaten yet, and so they could be sitting in the same chair, in the same posture, and they can be measuring this every day. So every measurement that we take, we know is a very controlled and accurate measure that can be compared to other baselines taken at other days. And so the best thing one of the things that I do is every morning I wake up and I take a 5-minute baseline HRV measurement to see what my measurement is, how high my heart rate variability is compared to the day before, compared to the week before, to give me an understanding of how well I slept and how well I'm prepared for the day, and maybe if I'm at risk for getting sick. Because if I wake up in the morning and my heart rate variability is very low, there's a chance that I'm more prone to catching a cold, for example. And so knowing that, you can take some steps in the day to prevent getting sick, for example. So it's that spot checking every morning. And so like if you're giving an intervention to a patient, you want to see how they're improving over time, the best way to measure the improvement is by having them take a baseline every morning so you can see the difference over time. Then the other application for using heart rate variability is, so I'm already at 15 minutes and I only have 5 minutes left, is to measure throughout the day and trigger a biofeedback alert. So we have a solution that will trigger a vibration on your phone or your watch, and a visual indication that your heart rate variability has reached some threshold, so that you're aware, you can become aware of what's going on, and then you can practice breathing. And so here's an example. Here's some best practices on how to take a baseline measurement. I'll share these slides with you later, but you can see from this graph that your HRV measurements will vary depending on whether you're sitting, standing, or laying. And so obviously the goal is to always do it in one position if you're going to compare. And really the challenge is, it's not, measuring your heart rate variability without context is not very useful. So what's useful is triggering the individual when your heart rate variability reaches a certain threshold, so that you become aware of what's going on. Without that awareness and that contextualization of what's happening, the readings aren't very useful. And so the biggest challenge always is trusting the data. With all the different devices and the different types of measurements, how do you know that the data that you're getting is accurate? And one of the ways to trust your data is by becoming aware of how the data is filtered, because there's so much noise and every device filters out the noise a little bit differently. You want to make sure whatever device that you're using is filtering noise properly. So there's different types of noise, sources of noise, and you want to make sure that your device has these filters to reject the noise. And then that's the challenge, is every device and every research study probably has different filters for rejecting the noise, and so it's very hard to compare the results. And so signal processing, like we do for EEG and all our other biofeedback signals, is very important to consider and to understand. And there's different types of filters. We won't go into that, because just one heartbeat that's not filtered could really skew your results. And as an example, Kubios is one of the most recognized softwares for filtering and analyzing heart rate variability data. And so we did some studies on different types of filters and looking at Kubios versus others, and you'll see that the raw data is on the first column we have a number 115, and then at 30 minutes is 183. So if you don't filter the data, then you're going to get this raw data that's noisy. But if you apply the filters, depending on the filter, you'll get more accurate data. And just by rejecting one heartbeat that has a noise, or maybe it was ectopic, could result in more accurate data. And the data can be measured in different ways. There's two types of measurements for heart rate variability. There's a time domain and a frequency domain. I think most of us are more focused and aware of the frequency domains, the high frequency, low frequency, and the balance between the two. But there's also time domains, which is SDNN or RMSSD. Those are what's really published a lot in the scientific research. But it's good to know to have both if you can. The RMSSD is highly correlated with a high frequency range, which is the parasympathetic activity. And so the measurements are almost identical. So there's different time domain measurements. RMSSD is very good for short-term measurements like 5-minute baselines, versus SDNN, which is used more in population studies because it measures 24 hours of data to give you the results. And we're all aware of the different frequency bands that could be used also as measurements to compare. And so I personally recommend RMSSD. It's very scientifically proven. It's not so recognized in the literature because historically the medical literature was done in population studies, and so most of the data is in SDNN, but RMSSD is just as good. And it's very highly correlated with a high frequency domain measurements. And so there's many applications we talked about on continuous heart rate variability monitoring. Obviously, one is biofeedback, and this is my last slide. It's also used a lot in exercise. People who are trained athletes, they measure their heart rate variability in the morning to see how well their body is prepared for training that day. So if they wake up in the morning and their heart rate variability is low, they're not going to train really hard because they're going to increase injury and actually probably decrease their potential. And so just like the exercise people look at heart rate variability to decide how well to exercise, I believe we all should be looking at heart rate variability to see how healthy we are in that day and what we can do throughout the day to improve it. Predicting sickness. We know that low heart rate variability is related to death and illness and sickness. And so one of the applications of continuously monitoring heart rate variability is through machine learning is to predict possibly when somebody is getting sick. And if we can intervene in advance, maybe we could help reduce a heart attack or a flu or some other kind of sickness. And we've seen studies for heart rate variability being used to treat a variety of different disorders like depression and anxiety in the lab. But now we could take it to the real world. So in summary, there's a lot of benefits for wearable. It's really early. It's really important to know the device that you're using, the types of measurements and the accuracy, how it's being filtered. I think it helps to increase compliancy because it's very difficult for patients to come into your office and lab once a week and a lot of no-shows, but now they have a tool that they can take at home and use it every day, very easily. They can wear it for days at a time, and it's just continuous. It's hardly any effort. Obviously, you want to use a consistent device so you can compare the results. You want to contextualize the data because the data without a context is not really useful. You want to know what's going on at the time that you took the measurement. And so anyway, so there's a bunch of things that you want to consider as you select a device, design an experiment, collect and analyze the data. And so these are just some really high-level things to keep in mind when preparing to do this type of biofeedback. Okay,
big
so
round of applause. Whereas there's never enough time in a presentation, there's always enough time to meet someone, have a hallway conversation, and deepen your knowledge for the love of this field. So please do take advantage of a small meeting to grab somebody in the hallway.
Yeah.
I also value at conferences at least one question as a follow-up. If there's one burning question, otherwise we'll hold some questions for the end or the hallways. Eric, brief question.
I missed part of it. The question I have is because I've used some wearables for patients, and I had a person that's AFib.
yeah.
And with the AFib, because it's not normal to normal, it looks like she has great heart rate variability.
Yeah.
And so when people have AFib or they have PVCs, then you really have to be careful.
Exactly. Yep. Yeah. So you want to make sure whatever device that you're using has a software that will detect those ectopic beats and filter out the results because it will definitely skew your data.
Good, terrific.
Thanks, Eric.
Next, we're going to segue very quickly and smoothly over to Dr. Stephen Sideroff.
Good morning, everybody. When Yair came to me with his software to monitor 24 hours, I was kind of excited, really just to check what that would look like on myself. I actually, right now, I'm monitoring, and I'm going to just pass my cell phone around, and you can see the effects of a couple cups of coffee this morning. That's my heart rate. There's a wellness score that you can flip to, but we'll start with that. So also, when I got that, I was on my way or about to go to Costa Rica, and so inspired by a talk that Barry Sturman gave years ago in the title was something like "On My Way to Bora Bora." I thought, well, okay, let me see what I can do in terms of this and my heart rate variability while I was doing things, climbing volcanoes, etc. in Costa Rica. Unfortunately, I didn't realize at the time that you needed to be connected to the internet in order for the data to get stored, and so I don't have any of that data. However, I have a video of me ziplining in Costa Rica, so we can get a 1-minute idea of what I might have had if I had internet connection, which I didn't in the middle of Costa Rica. I don't think the sound isn't on, but me yelling and screaming while I'm doing this. But that's a huge drop there, and there are a couple of others that were. When you're heading toward those trees, it's pretty hairy. Yeah. And zooming through them. So.
Let's see your face.
Maybe next time I'll have my heart rate variability during that. Okay. So what I'm going to talk about is using what I would call more, rather than 24-hour, I call it more continuous recording, because I didn't use it on a, when I started to do it with myself, I found a lot of variability, as Yair was talking about, and so I'm using it in a slightly different way here with 2 clients. I'll talk about my work with these 2 clients to help support mindfulness, their motivation, awareness, to disrupt patterns. And I thought this was really a good way to use this kind of approach and give the clients a greater sense of control. So the first is a 37-year-old woman I saw who was a professional skater and actor. And I saw her almost a year after she was involved. She was in a foreign country with a small group touring, and the group was attacked by the military. I mean, attacked. A few of them were killed. She was very, very seriously injured. That was only part of the trauma, the recovery, going to a hospital in this third world foreign country and getting mismanaged in the hospital, etc., and then being medevaced back to the United States. And so I started seeing her about 10 months after this event occurred. And so, a lot of things you do in terms of treating PTSD, you try and help them make discriminations between the environment in which the trauma occurred and the current trauma as at least part of the ability to regain a sense of safety. But particularly in the last couple of years, the environment, and with her trauma, it was very difficult for her to make discriminations. She kept getting triggered, and we did psychotherapy, biofeedback, neurofeedback. I did a series of neurofeedback sessions. But during the first year that I was treating her, she actually had 2 inpatient hospitalizations for real severe paranoia, dissociative reactions. But across the 2 years that I've been working with her, she's been getting better and better, and a greater sense of ability to recover after her trauma gets triggered. but still a long ways to go. So in this kind of sense of total access psychophysiological monitoring and feedback, I was trying to really reveal the connection between her emotions and her physiology, to engage an early proactive process as she's been getting better and better in her ability to do the biofeedback. So using notifications to engage her recovery process, I thought would be helpful, to demonstrate and enhance the effectiveness of her existing tools and progress, and to motivate frequent biofeedback training and relaxation, and to just feel a greater sense of support and structure. She immediately felt good that I was giving her something, almost as if something from the therapy environment she was carrying off with her after our sessions. But she has been very fearful of being suddenly triggered out in the world, and how would she handle that, which caused great anxiety and fear of even kind of engaging with other people going out. And so with this device, she actually immediately felt like, okay, now I have something that I can use. It was a support, and perhaps a way to interrupt negative feedback loops. So the first instructions and goal that I gave her is that when she was aware of any uncomfortable feelings, to use that to check the app, and is there some correlation? When she saw that, did her physiology reflect that uncomfortable feeling? To do her relaxation breathing to improve her app score at those moments in which she had that emotional reaction. And then does the impact, and then to actually have her see if that had an effect. So number 2 was to ask her to be aware of when she had positive feelings and to check in. This is something that she didn't do very often, so I was simply giving her an instruction to, in a sense, unconsciously have her start thinking more about positive feelings. And then we had her review her wellness score, and then to select the 20% level, where 20% of her scores were below, and set that as her notification score. And when it dropped below that for 2 minutes, she would get a signal about that, and then at that time to do some of her breathing. So here's her score. One of the things you can see is the tremendous variability in this is the wellness score, RS and SD. And then finally, when you get the notification, and if she has time, not only do the breathing, but also do the M-Wave biofeedback, which she had just purchased. So to extend the benefits of what we were doing in the session, let me just kind of go to, she was reported being in a very dark place right before we started doing this, and just engaging in that process, partly a placebo effect, helped move her out of that place, giving her this sense of control and a positive shift in her focus. Okay, now there's something that I could do moment by moment. These are some of her experiences. It informed her and identified what was most effective. She was able to discover some connections between her emotions and the responses that she was getting. And one of the things that she found was when she was feeling some annoyance or frustration, that's when she'd get the notification. And she began to make a connection between these kind of emotional blips and how it led to being triggered. And so it actually served to disrupt that process. I only have a couple more minutes. I want to, let's see. So here, the second half of this is doing the M-Wave training, and in fact, we didn't see a lot of change based on her training in terms of the her heart rate variability. But, and here's just a comparison. I know you can't see this, but again, it was a half hour before she did a half hour structured relaxation, and there was only slight improvement that was not significantly significant. Again, here, she started doing the relaxation right at this point. So there was some, if you took a line, there was some improvement, but because of so much variability, it was not significant as well. I don't know if it's about to go into my second, yeah, okay. So, but in summary, this was a very helpful way of engaging a client in a ongoing process. We always talk about homework and how helpful homework is, and how do you really get clients to follow through and do homework. I found this to be a tremendous way, because they're wearing it, they're conscious of it, and they used it on a regular basis, and then they found that it was helpful, and that facilitated them using it even more. Anybody wants to check with me at some point? The other client, who's a migraine client, was also very interesting to do this work with. Thank you.
Big round of One question, if it's burning, otherwise we'll continue and proceed on.
What is the app that you're using?
So this is Yair's app that I was using. It's called Cardiowell.
Next, we'll have Beth Argus tell us in a very few minutes.
Okay.
So,
Okay.
you're on.
Okay.
Thank you. I have
Beth, let me know, pass those out for you.
Thank you.
Why don't you go ahead?
Okay.
Thanks.
Well, it's great to be here presenting with Dr. Sideroff and Yair. And I'm going to talk a little bit about how we can sustain the benefits of a short-term stress and resilience program at UCLA. I work in their employee assistance program, and we see up to 800 staff and faculty every year with a variety of problems. We say no problem is too big or too small for us, and but we only provide brief interventions. They can come to our office for 3 sessions, but we have developed this biofeedback program, resilience and stress management program, and that is a 7-session program, up to 7 sessions. I'm going to skip some of these, but well, again, people that come to our office come with a variety of reasons. Work stress is probably one of the top reasons. Anxiety, depression, chronic pain, relationship issues. We get people that are in life transition, maybe have a new job. So these are all the different kinds of reasons that people come. And Dr. Sideroff trained me a couple years. We purchased a biofeedback system, and he trained me in his resilience model. And some of you may be aware of his program. So we use the basis of his CDs that we allow people to use in the program. They take a CD every week and they listen to it. And then based on that, we developed the program, and that's what I handed out to you. You can see a 7-session model. They start with, we give them a brief questionnaire starting the program about their stress. We do a stress assessment. We introduce how stress manifests in their bodies. I've been using Dr. Pepper's breathing video. People really like that video. And so we do different forms of biofeedback. And it's been very successful, the program. So far, we have had 320 people participate. 81 individuals have completed the whole program. And we're getting more and more referrals from a program called the Work Strong program. These are people that have multiple injuries in the workplace come and use the program. And using Dr. Sideroff's resilience questionnaire, and we have shown that the resilience has gone up. For example, in total relational, it's gone up from the higher score, the better, from 7.96 to 8.99. Here. In total organismic, this is a section that involves physiological stress, emotional stress, cognitive challenges, and this is the section that we've had the biggest improvement. It's gone up from 6.74 to 8.35. So again, the higher score, the better. And total process, which involves presence, flexibility, and power, it's gone up from 9.76 to 10.73. So total resilience, they've gone up. This is what the biggest issue that people come in for, I think, is anxiety. And we have been able to show that we've dropped anxiety levels, one whole category on the Burns anxiety checklist. So that's very rewarding for people who come to our office. You know, they leave feeling empowered that they have more control over their symptoms. And also, most people don't have very high depression. Some people do, but the majority don't. But they still drop their depression by 50%. So that's very effective. And then some of the biofeedback that we do training, HRV training. And this one is a slide where I'll do 2 minutes where someone just breathes alone just by closing their eyes. And then 2 minutes either using the pacer or, I better hurry, okay. So let me get to the meat of it. The bottom line is we want to continue the benefits of this program outside of the biofeedback program because it's only 7 sessions. And we have been very fortunate to have Yair help us and give us some straps. And right now I also want to, just like Dr. Sideroff was passing around his phone, I'm monitoring myself. This morning my score was very low because I was nervous about the presentation, but let me see if the pulse starts up here. Sometimes when it gets too dry, the heart rate doesn't work. Obviously, it doesn't work when you really need it to, work. But typically, what I would do is I would just re-moisten the band. But what it's doing is it will show my pulse here. A little while ago, right before the presentation, it was up to 90. So I could tell that I was nervous. And normally, it's like a 60 when I'm resting. And my wellness, I'm going to share some slides with you. But I'll pass this around. It has the pacer, and of course now probably have to wet it to get it to go up. But so far we've had 3 program participants, and they've been trying out the sensor, and all program participants have high stress in their jobs. Some of the presenting problems include stress, anxiety. Most of these are moderate to severe. Some of the health issues, hypertension and atrial fibrillation. I'm glad that Dr. Pepper brought that up for my client. And these are some comments from the people using the app. They said, overall, this app is simple and easy to use. The default notification setting worked well for me, for alerting me when my wellness score was low, usually when I was stressed or while walking fast. After using it a few times, I felt it has made me more conscious of my breathing and stress level. And then another comment was, I like that it shows HR and wellness in real time using the paced breathing feature. I was able to wear the monitor for 8 to 10 hours and it did not bother me. and that I can continue my biofeedback outside of my office. So see, these are some of the comments. All participants, when they were nudged, felt like they used the breathing app, and that improved their wellness score. Biofeedback sessions help to reduce blood pressure in 2 participants. We take a measure before and after. And then for me, I want to just show you a little bit. I was a guinea pig for the app. So this was my baseline in the morning. So 53. Then as I was getting ready for work, I got my first mindful nudge, which was set for me at 25. And then I sat down and did some deep breathing, so I was able to raise my wellness from 24 to 42 just by doing the breathing. This was my morning baseline after a stressful day. And then again, doing 2 minutes of mindful breathing after a mindful nudge. This I found very interesting because I think one of the things we really need to do is find techniques that work for different people, what works for them. So the first was me doing some breathing. The second was me just thinking of something positive. And the third was doing the heart math awareness. Their coherence. Are you familiar with that technique?
Yes.
To me, this show, I think it's important that people learn which techniques work for them, because one technique may not be the best for another person. This is doing housework on a Saturday, so it went down. Yeah. Sunday resting. So to me, this showed me, how important it is to rest and renew over the weekend. This is getting a hug at night. My wellness level went up. This is a baseline drop because I went to bed way too late. But then when I talked to a family member, my wellness went up. So that's where I think the beauty of this app, you can really start learning what works for you, what are the things that you need to do to maintain your wellness. And and this is just the day before the conference. At the end of the day, I got a crisis call, and then I had to prepare to come for the conference, so my wellness dropped quite a bit. Overall, you can test like a 1 week of wellness, 1 month of wellness, and for example, for me, my wellness over 3 months has been going up since I have had this app. So I'm gonna just jump to the end, and again, I think it's just becoming more and more aware of how stress manifests in our body throughout the week, and that's the beauty of this app. So I have gained some valuable insights about my wellness and stress level from using it, and we have had positive response from the program participants trying out the app at UCLA. And we use a couple other resources, the UCLA Mindfulness Research Awareness Center, UCLA Ergonomics Office. I think from Dr. Pepper's talks, I've really started to incorporate more about ergonomics. The FitWell program is an exercise program at UCLA. Dr. Pepper's website, HeartMath, and breathing apps. We use different breathing apps. There's an app called iChill, and then Headspace is one that I found out that was donated to all the UCLA athletics department by a former athlete. How we're trying this into UCLA's Employee Assistance Program to continue the benefits of our EAP program's resilience program.
Let's give a big round of applause. As promised, we have a few minutes for questions. One, let's go.
I just wondered if you could compare somebody using just HeartMath to the Cardiowell, which I understand includes HeartMath.
Oh, okay. So the HeartMath, I only use it for one of the sessions at UCLA, and we only use it when we're doing the section on like cognitive behavioral work. to help people kind of move from like more negative thinking to positive thinking. I find that that goes well. So I don't think I would be able to tell you how to compare those two, only that I like to merge the two in that it's important to see what are the things that affect our wellness scores. And I think some of them have to do with when we're in more positive environments. But we haven't really compared those two, but that's a good question.
My second client, and I can talk with you later, had the inner balance on her ear and clipped here. And she used the 3 different tones of 3 levels of coherence as her feedback, continual feedback, and she found it very helpful.
Yeah, that's what I was wondering, was if you just used, even if you did the, compare the readout of the inner balance over time versus this app, I just wondered if the app adds.
Now, a slightly different question maybe can be answered. But when you observe people in discussions or in arguments, which happens a lot in social settings, there is some suggested evidence if the heart rate goes over 100, that obviously depends upon the baselines, then the people's communication skills really break down. So in this set, and that comes out to work from out of Seattle very nicely in long-term couples, that those who keep arguing when the heart rate is up really have very poor outcomes. If, on the other hand, you can interrupt yourself and be reminded by a vibration or something, say, stop, time out, the couples do remarkably well with the long-term follow-ups. I don't know if the app can do this, because not many, you want to set some sort of threshold with probably a time delay.
Yeah, I can speak to that. So the app and other apps have 2 types of thresholds, a heart rate and a heart rate variability. As we know, the heart rate variability is more sensitive to emotions and may even trigger you in advance of your heart rate going to 100. So both options are available, but yeah, I guess the goal is to circumvent the emotion before it gets too high. Whether too high is a heart rate of 100 or a heart rate RMSSD value of 20. And maybe a person's body responds differently and maybe more sensitive to heart rate than heart rate variability. But I think it's important to give multiple types of feedback, and maybe heart rate variability by itself is not as useful, but coupled with heart rate, maybe can provide more information.
Yeah.
I have a question about heart rate variability, and I've heard it a lot of times before that, and brought it up, somebody brought it up here.
Speak up.
Oh, sorry, about heart rate variability, as you get older, it decreases. Is there any research about it, about ways that, either exercise or diet, or is there something that you can do to lower that problem?
From the research that I've read, one of the most effective ways to increase your RMSSD or heart rate variability is exercise.
So let me
And sleep is also very, very important. Diet is very important. Obviously, chronic stress, but sleep is amazing, and exercise are 2 ways to increase it. Eric might have some other.
The reality is on exercise. It isn't just any exercise. If you do marathon running, it doesn't do it.
Right.
It's interval training.
Okay.
So very short, high intensity moments of good recovery. So you run up the stairs for 1 minute, and then recover till you go to about 80 or 90. Then do it again. That is probably the best exercise you can ever do.
There's a great book called Fast Exercise,
Yeah.
which does what you're talking about, discusses it, and it's a fantastic way of exercising 3 or 4 times.
And there's the other one called the first 20 minutes, because within that brief high intensity interval training, there's also this reactivity and recovery phase, and we all work in the recovery phase. It's not that you can react, but rather that your systems, and that's plural, can resettle. So whereas we focus on, we pay attention to shift our intention, and if your attention is to the heart rate signal compared to the muscles, I see Bob Grove here about ready to get started with his EMG versus a central nervous system versus a body temperature or any other signal. How we pay attention in order to shift the directions that we go is what we all love to do with devices, ultimately removing the device and generalizing it without the device. With no further ado, we're going to end up this conversation. Let's give a big round of applause.
If anybody would like to use my resilience questionnaire in your practice, you just send me an email and I'll send it to you, and you're welcome to use it.